Hi, everyone, and welcome back to the Health Tech Edge. I'm Mike Moore. In this season, we've been focused on the real-world adoption of AI in healthcare, what's working, where it's hard, and how we make the shift from theory to action. A few episodes back, I had a great conversation with Adam Block from Charm Economics about the ROI of AI in healthcare. In that episode, we focused on cost savings, productivity gains, and how to measure financial return. Today, we're going to look at a different lens, the ROI of AI ethics. What does it mean to measure the return on doing the right thing? And how do healthcare leaders navigate that in a world where AI is moving faster than most organizations can keep up with? Joining me is Shannon Kennedy, a longtime healthcare leader, strategist, and one of the contributors to the new position paper, The ROI of AI Ethics, Profiting with Principles for the Future. Shannon is a healthcare strategy and technology advisor here at Productive Edge, and she also serves as the chair of the healthcare group for the Digital Economist, the organization that published the position paper we're going to discuss. She's a seasoned policy and operations expert with deep experience in value-based care, AI frameworks, and interoperability. She's also been an EPIC implementation leader, a revenue cycle analytics expert, and a public policy advocate for eliminating prior authorization. Shannon, welcome to the show.
Thanks, Mike. Thanks for having me.
Yeah, of course. You obviously have a tremendous amount of experience, as I just detailed in your bio. You've seen it both on the practitioner side of things as well as on the consulting and kind of the industry side that we work on together today. Uh, I think that there's a lot that's going on, right? As I mentioned, I did the episode with Adam Block and Charm Economics, just straight up ROI of AI in healthcare. But you and the team have taken on the specific focus around AI ethics, right? And kind of looking at the ROI of that. So maybe let's start with that. What inspired this project, and kind of why now did you take it up?
Yeah, I mean, so this project was really born out of the work that we're doing at the Digital Economist, although I think it's very relevant to the work we do here at Productive Edge, and I'll try to connect those dots. But at the Digital Economist, we really try to look at technology from a human-centered lens, and all of us are very pro-technology, but we also are always trying to play the devil's advocate and make sure then when we're thinking about AI and the implications of technology in general, that we're thinking about it from a human-centered lens. And what are the consequences? What are the pros? What are the cons? And to be completely transparent about how this particular position paper was born is we were really trying to figure out what is a way for us to create practical application for thinking about ethics in AI. And most of the contributors to that particular position paper are ethicists or organizational development psychologists. And we see a lot of headlines right now around, some of the bad things that can happen with AI. But at the same time, we didn't want to come in and be these, kind of chicken littles and the sky is falling. What we wanted to be able to do is just provide a framework for people to think about how does this fit into my general risk conversation already? How do we put this into more of a GRC or an enterprise risk management mindset? How do we help boards, decision makers, CEOs? It doesn't really matter where you're at in the organization. Think about the pros and the cons of AI. And from my perspective, it was really intended to be a risk tolerance regulator. So how do we just normalize everybody's risk tolerance and try to use metrics that we are already used to using in business, but just apply them with an AI use case?
Yeah, and I think most people who, certainly in healthcare or, just in the world, like everybody, I think has awareness of the Hippocratic Oath, right? Do no harm, right? Like this is something that the doctors and healthcare providers take as a pledge when they work in this industry. So, at some level, that's a kind of a statement of, you're expressing your ethics, kind of that. But there are more specific terms you can put to, like, what does it mean to be ethical in healthcare, right? And I think that's part of what you and the team have done here in this paper is trying to take it from the abstract terms, make it more practical, and put it into the ROI discussion. So why do you feel that's an important focus here for healthcare?
I think it's important for healthcare for a couple of reasons. And sticking to healthcare, I think that we probably have, in my opinion, the opposite problem as what you might see with a lot of other like for-profit industries or publicly traded organizations, where the desire to jump into AI and not necessarily consider all the risks is perhaps more of the problem statement. In healthcare, we kind of have the opposite. We have very high fear factors when it comes to anything new with technology as an industry, and not all, but I would say overall, we tend to be very poor change agents. I remember when electronic health records were born. I'm still old enough to remember the paper records, which we still have many of. I also remember when the internet was born. And I also remember when cloud computing was born and electronic health records came out with the cloud computing and not having the on-prem storage. All of those different things that healthcare has tried to travel through has been very, very challenging for, I think, healthcare and people's very low tolerance for risk. So, what I like about having a framework for healthcare in particular is being able to say, okay, pragmatically, how can we measure what is it going to cost us not to implement AI, or what do we need to be thinking of or trying to measure if we do implement AI? And that's really, from my lens, from a healthcare perspective, the overall use of this paper.
Yeah, that sounds good. So let's use that as kind of the transition into the practical side of this. So when we say ethical AI ROI, what exactly are you recommending that healthcare organizations measure?
Yeah, I'm recommending that they, number one, look at what do we want our AI strategy to be. Everybody should be thinking about it, and if they're not thinking about it, talking about it, implementing a strategy, if they don't know where to get started, then this is a paper that I feel like is, you can take it off the shelf and you can read it, and it educates you on what are the different risk frameworks you might already be used to. And now we're just throwing in another kind of domain here for AI. What we want folks to do is to be able to say, okay, how am I doing risk analysis today? What are the ways that I can now add AI as this domain? And then what are the ways that I can essentially take some components of how I measure risk, whether it's human centered risk or it's regulatory risk or it's quality risk, whatever that risk is in healthcare today, they're already measuring it. Folks are
Mhm.
already measuring in these domains. From a regulatory perspective, we're always looking at things from, is that going to, get us in trouble? We always joke about, is that going to put us in an orange jumpsuit? Is that going to get us a fine? Is that going to have some kind of reputational element to it? We want you thinking the same way about AI. If I implement this, let's play the tape. The way I measure that today, let's just use, human resources as an example. If I implement this particular solution, am I going to be able to measure the impact on my workforce? A lot of times people think about AI and workforce as, oh my gosh, it's going to replace everyone. Well, no, we all know this is still very early days. Instead, what we're trying to ask folks to do is, how is it going to impact our employees? So, can we measure sentiment? Are we going to look more like a forward thinking organization? When you look at employee sentiment on a lot of the public domains, whether it's Glassdoor or you do any kind of a Google to see, is, X healthcare system a good employer to work with? You're going to see comments in there about, do I have the tools I need to do my job? Those are questions you get asked. And if you're going to adopt AI and you're intending for it to be a helper or a co-pilot, that could be a very positive sentiment that you start to measure from implementing it. If you decide not to implement AI, is there going to be detriment to that? So I know that a lot of the kids that are starting to come into the workforce, they want to be able to use tools. And even as organizations today are trying to figure out how to roll out just simple tools, if you are not putting a policy in place around how your workforce is using AI because you're too afraid, and so your answer is no, then potentially the risk to that is you're going to not be a forward thinking or innovative employer, and you might lose people because they feel like they don't have the tools that they need to do their work. So that would be one way to say, how do we measure the impact to our workforce? I'm going to make the assumption we're not replacing everybody, but instead trying to bring in a co-pilot and give people ways to be more productive.
Yeah, and I think that's something that we know there are parts of organizations where they're talking about payers or providers, that there are parts of their organization that have tremendous turnover of staff and that they struggle to staff, some of these entry level roles or something. And if you think about, you're a new team member coming in, you're using antiquated systems. Anytime you want to call a member or a patient on the phone, it takes half an hour to an hour to prepare because information is spread across a variety of sources, right? You're being asked as a human to take large amounts of that information, synthesize it, and come up with a game plan of how you're going to call, right? Just as one example, like kind of frustrating, not
Yeah.
what you expect. You're coming, especially if you're a new college grad or you're coming out of even, maybe a high school education, but having some maybe, community college education or something that's kind of preparing you for the business world. Then you come in and you're using antiquated tools, right? The fact that we all use the most modern software in the world on our smartphones every day, and then we come to work and have to struggle, right? So I think the impact on employees is really a good one, and there's a sentiment, and I think I'd have to imagine there's a productivity metric around that as well too, right? If it's a coverage or a number of members or patients or communication or those kind of stats as well. But in many ways, I think a lot of this stuff, when you're speaking earlier too about the risk framework, I'm thinking in some ways like we act like AI is something new, and it is new in a lot of ways and the way that it's being applied. But in many ways, it's similar to the things that we've been doing for technology initiatives before, right? I mean, how do you counsel clients when you're talking to them about, is this really something that's new, or what is it that's new about it that you're encouraging them to consider?
Yeah. No, that's a great question. And I think that, for the majority of my career in industry, I served in regulatory, compliance, privacy, security roles. And I can tell you, I spent most of my time talking people off the edge. And so it's really about being able to dispel a lot of myths. I mean, as you mentioned, AI is not new. Anybody who's been doing any kind of applied math or data science knows this is like sometimes 400-year-old math with just a bunch of compute. so so a lot of us are extremely excited about how this can now think in multidimensional ways. But I think for me, it's always been about dispelling the myth and still validating the concern. What I don't want to do is be dismissive. I don't want to be dismissive about risk. I want to normalize everybody's risk tolerance so people can make business decisions. So, for example, I was just having a conversation with a physician just the other day, and we were talking about AI. And we were talking about, in particular, some of the applications around her being able to have a sensor where she can have conversations with her patients, and that can be captured so that she can really get rid of a lot of cognitive and administrative burden load. And she said that her department had been trying very hard to get their compliance, privacy, and legal teams on board to allow them to use these recording devices. And she was running up against a wall. She said they just kept saying, no, it's a HIPAA risk. And I thought that was a very interesting answer, because the reality is that if you have either your own contained service or you have a closed network or a closed service or business associate agreement, or all of the major language models have HIPAA compliant and GDPR compliant models available, then you really don't have a HIPAA risk. And so I think it's really interesting when you start peeling the layers away, first dispelling the myth around what is, that kind of knee-jerk reaction to no. we can't do it. That's just too risky. So I think, for me, it's how do we peel away the onion of what do you perceive as risk? How do we narrow that to a point where people feel comfortable of weighing it and measuring it and having really good conversation about risk and then making business decisions?
Yeah, and I think that your point is well taken, and it makes me also think like this is uh, for some organizations, depending on their maturity, this stuff becomes overwhelming real fast, right? Because just organizationally, they haven't been very progressive with technology. They're very traditional. I think the reputational risk that you mentioned earlier, like there's nothing more local in many ways than your healthcare system, right? Like your local hospital that provides care to the community, and everybody's been there with a family member or themselves or something, right? Like it's really deeply woven into the fabric of the community. And so I think the idea of something going wrong or some data being shared inappropriately or those kind of things, like there's obviously the compliance side of it and kind of financial risk and the government and those kind of things. The front page paper like is kind of the piece that worries a lot. But I think in those situations, and imagine you're guiding through example, right? You're sharing with them others who are out there who maybe are more progressive and have more of uh, a risk tolerance that's suited to it. To like look at the others who have done it. How did they sell it internally? And really, this is something I know you also. I'm kind of doing a word salad here question, but I know you also talk about the board of directors, right? And how important that this is something that should have their level of involvement, but they may not have the background. So I think there's discomfort in a lot of this, but I think there's a way forward. And I'm not really phrasing a well-formed question here, but what's your take on all of this? And kind of like when you're giving advice, how are you directing and kind of helping people through this?
Yeah. Sometimes the sometimes I'll answer the question with, what not to do, right? So here's what not to do. Don't just promote your technology person to be your new AI person. That's not a strategy. I think people associate AI with IT, and really you need to understand what AI is before you make an assumption that you can lump it all with IT. At the board level, everybody at this point should have an AI strategy. And so I think that if you are not putting AI strategy on the table and you're not bringing folks in to educate you on what AI is, then that's something. Don't be an ostrich. Don't stick your head in the sand. And I say that not to be cynical. I say that because you will get left behind. The risk here for me is doing nothing.
Hmm.
And as an industry, what I perceive is going to happen, and again, bear with me because I tend to be a little bit out there and a bit of a futurist, but I really think that we're going to see the most movement and the most innovation in emerging economies. They're not going to have to deal with the sunk cost syndrome of these rigid EHR symptoms that these systems that have millions and billions of dollars dumped into them, where folks are like, well, we can't really do anything right now because we have no budget to improve what we've already spent our money on. So I'm very excited to start to see what's happening. I'm kind of, going down a rabbit hole, but I'm less optimistic about how the West is going to respond. I'm much more optimistic about what we're doing at Productive Edge and the Digital Economist globally, where we're actually able to go to other countries and other spaces in healthcare for for governments and agencies and innovators that are hungry for this. They already can see what's not working in the West. I think we're going to learn so much about how AI can be helpful and useful from those emerging economies that are ready to take AI to democratize access to healthcare for their citizens.
Yeah, it is exciting because I think there's tremendous potential there because in many ways it's the ideals and the vision of the West and kind of what we aspire to be and how we'd like things, but without the technical debt, right? That people carry the sunk costs in those systems. How much of the percentage of your budget is spent maintaining the systems that you have with all that sunk cost? How much is being spent on innovation, right?
Yeah,
And kind of balancing that out. And I think the other contributing factor is how much regulation exists, right? And kind of the incentives-based system in the United States and kind of all that's with it. So, what if you were actually focused on trying to improve care, not
right.
just get people to enroll in programs because that qualifies for the incentive? You don't have to do anything beyond that, right? So, it
Oh my
is
gosh.
interesting what's happening in Africa or what's happening in Asia and some of the different systems. And then I think it does feed back to the US, right? The US healthcare system still needs
Hmm.
help and there's still a lot of work to do and a lot of people who want to improve it, right? So there is
100%.
a way to kind of
Yeah.
bring things back together.
Yeah, absolutely. I think that the big opportunity for AI is going to be all of the, number one, enable your workforce to use tools to make them more productive. Invest in the enterprise version of Copilot or look into a HIPAA compliant Anthropic or a HIPAA compliant ChatGPT at a minimum. Start bringing in organizations like Productive Edge to run a pilot on a use case and see how you can get something with AI in particular. AI and Agile combined is just, such a force multiplier, and being able to see how you can instantly improve a workflow with what we like to call, the AI supercharge. You don't have to rip and replace systems. I think that's the other thing that folks don't understand is AI is really enabling us to like legitimately MacGyver workflows. And I love that because it's not just it's not fragile paper clips and duct tape anymore. It's like bona fide hardcore hacks that you can now take these workflows for all these disparate systems and create something super meaningful without that rip and replace. So I think that there's a ton of things that folks could be doing that they're not necessarily thinking about. And that's the other thing that I love about Productive Edge is, there's been a lot of thought put into these accelerators that are very, very specific to use cases, whether it's closing quality care gaps, whether it's providing an aggregated member 360 view without having to build a whole new platform, or it's helping the folks that are out in the field taking care of members or doing some type of patient care have that unified face sheet, as we call it, or even having the prompt of this is Shannon, she's 54 years old and she needs to get her mammogram, and we need to also ask her the last time she had a colonoscopy. If they have that prompted up and ready to roll without having to read through bazillions of pages of records, these are easy, simple things. And I also think in the US, and I'm going to be a little bit cynical here, but I do think that there is a lot of diamonds that get sold by some of the larger platforms of this is coming, we're going to do this, we're going to talk about this at our our user group meeting or whatever. But really what gets delivered is a very diluted piece of coal, no diamonds at all. And I think that's very challenging for healthcare. We just continue to have this constant pause, and that was the other reason that I was so passionate about being a part of the paper that we wrote. Is my point is, what's going to happen when you don't adopt in healthcare in the U.S. in particular? You will lose workforce. People are going to start going to the organizations that are using AI. They're going to go to the organizations where the cognitive load and the administrative burden is not in existence, where a doctor can be a doctor, a nurse can be a nurse, a patient can be a patient, and the rest of that garbage can go away. So I feel very optimistic about the West. We might have to allow the workforce to drive the change. I hope that they do. I hope that people get very selective and start flocking to the organizations that are being forward thinking. And then, as far as guardrails go, that's another thing, again, not to overplug Productive Edge, but we're standing up AI that has governance, being able to observe how your AI is operating, being able to have AI watch AI. I mean, there's so much possible. If you think about the human auditor or the human compliance person, that can all be done with AI too. And I think that's where folks are not playing that tape and understanding that there's a lot that we can do with this technology.
Yeah, well, that's incredibly well said, and I think a great way to finish the discussion here is pointing to the future and the great potential and getting people excited about it. So, for those of you who are interested in the paper, we'll put the link in the show notes, or you can go to Digital Economist and look up ROI of AI Ethics and find that paper yourself if you're just listening to this on audio. Um, I think it'll help you bridge really from the strategy to the execution, help get your board involved, like Shannon recommends. And certainly, if you have questions, feel free to reach out to me or to Shannon as well at Productive Edge. We'd love to hear from you. So thanks again, Shannon. That was great discussion. Appreciate you being here.
Thanks, Mike. Great to be here.
All right, well, that's it for this episode of the Health Tech Edge. If you like the discussion today, feel free to share this with a colleague, subscribe for future episodes. And with that, we'll go ahead and say see you next time on the Health Tech Edge.